Good evening. Today, Siddha Private Practitioners Forum is conducting its 7th webinar, and this forum aims on the upliftment of Siddha practitioners by conducting various classes, both online and of course offline. We'll be conducting webinars, then open panel discussion, induction classes, etc. And through this online sessions, we are now able to gather knowledge from many eminent faculties in different states and across the country. And also we are conducting case discussions in the WhatsApp group, and we are giving guidance and suggestions to those who are already practicing and for those who are planning to start clinics. So for that, maintaining that and for that purpose, we are conducting all such classes. Hope this forum enables more Siddha doctors to practice our system of medicine with more confidence and also to upbring their living, and thereby our Siddha system of medicine flourishes more throughout the country. And so now I invite Dr. Surya S, House Surgeon, Santhigiri Siddha Medical College, for moderating today's session. Dr. Surya.
Thank you, Doctor. A very warm welcome to one and all. Today, we're all here to attend the 7th webinar conducted by Siddha Private Practitioners Forum. As knowledge increases, wonder deepens. As a Siddha medico, every one of us must have come across the topic Nadi in a superficial aspect and will be keen to know more about it. Well, we have Dr. V. Balamurugan, BSMS, Amrutha Center for Siddha Medicine, Chennai, today to give us a deep vision on Nadi in the personal and professional aspect. Without any delay, let me welcome Dr. V. Balamurugan for the session.
Good evening, everyone. I don't know the homogeneity of the audience. How many of you are practitioners? How many of your students? I don't know. Anyhow, I got chosen a much safer, safer way of presenting something. I have added both basic thing as well as some clinical arenas. Since it is going to be a introduction or an ice-breaking session, I am not going to going into details today. I'm going to touch the things where we shouldn't, what we shouldn't do, and what we should do. Third, the comparison between our confidence as well as competence. These are the areas where we have to touch. The very, very important thing is autonomy. How autonomy, the autonomy is much needed for a Siddha physician. When it comes to my practice, I am alone. I could stand alone. I have never worried about any government service for my financial things, financial factors. I never gone for any private hospitals to work under. This entire session is all about how an individual can do wonders in Siddha field. Siddha field is all about nothing. There is nothing called the Siddha society. Individuals' brilliance and collection of individuals is a Siddha society. We are going to talk more about how an individual can contribute a lot, how we can survive, not just surviving. I think even after nearly 50 years of institutionalization of Siddha medicine, it is very harsh to see people talking about survival. Here it is about persistence and flourishing, shining. So let us see one by one. Instead of telling something very attractive, let me go one by one from basics to case studies. So before entering into my topic, this is my first slide. I want to emphasize few things. Once you finish your everything, we should start from grassroots level, from institution itself. We have to start. That's why I chose a track where I paid a part of small sort of institution where I started teaching everything. Because during college days, during our institution days, we are full of confidence with the fake wings. We are full of confidence. When you come out, the moment you come out, you think that you know everything. You think you know everything. Then comes the period where, with the sense of despair, it's more complicated than I thought. No, the things are more complicated, more tough than I thought. I thought, we can shine a lot, but even a survival become a big thing. That's a sense of despair after a few months, even after a few months of your graduation. Then start studying and all. Then there is a one peak where you will come to know that what I don't know. The time when you find out what we don't know, and the real appraisal of your own competence. Real appraisal of own competence, when you are very honest with your own competence, then you start realizing that you know nothing. No. The moment when you know that you know nothing, then starts the real learning, not the textbook. This is the Dunning-Kruger thought process. In 1999, he came out with such a thought process for medicos. I love this particular slide. You can go through those research papers about medical students and their psychology institutions and all. A lot of things are there. You go there, and it is too late for us. Yes, it is too late for us. But at least we have a lot of young students, and I want them to learn. First thing, they should unlearn certain things. Second, relearning. Unlearning and relearning is needed for practitioners. Pure learning for students. So there are two different groups here. One is senior practitioners. Senior practitioners means all the senior practitioners from Kerala should be younger than me, because the very first batch came out once after I finished my course. So technically speaking, all doctors from Kerala should be younger than me. So I have the rights to talk about that. All are youngsters, all are younger than me. Some kids, some younger brothers like that. So I advise everyone to unlearn what you learn up to now, then relearn several things. So the next 1 hour, what I'm going to talk, it's all about all about what I know. So everyone knows we have internet, we have Google in our hands, so anyone can know anything. Even a patient attendant knows a lot about his son's, father's, or wife's disease. So knowing is not an issue. It's not a big deal. So what you did, what you are doing, and what you are going to do. I am going to share what I did first. Okay, I'm not going to tell you what I know. That I can fabricate a lot of things. I can tell stories. I can tell stories with a lot of fairy tale end. That is not the case here in today's presentation. We are going to come across a lot of hurdles. I'm going to share you a lot of success, even higher number of failures. So I spent more than 15 years in emergency ward as a doctor. Don't come to conclusion as a doctor, not as a patient. I started learning Nadi from emergency ward only because I had the luxury. I had a lot of patients with the diagnosis. I saw patients the very first time since being a training when I was very, very young. No, now I have become old. When I was very, very young, I had the luxury to see patients where I didn't have the responsibility. I didn't have the responsibility. I didn't shoulder the everything. I was not the person who is doing all these decision makings and all. So I was just an observer. I went through a lot of case sheets. I could see hypothyroidism, pericardial effusion, systemic lupus erythematosus. A lot of case sheets with a lot of diagnoses. So diagnosis is there. Already someone did that. Then I started seeing Nadi. I started seeing Nadi in the patients already who were diagnosed. So slowly I approach. It's a completely reverse approach because non-availability of teachers. I never met a teacher who can teach Nadi. A lot of people are there to tell stories, but no one was there to teach Nadi within a logical and scientific way. I couldn't beat anyone. So one particular point of time, I came to realize that it is not an easy job. We cannot expect. No one is going to descend from heaven to teach you. It is up to you. You have patience. You have a degree. It is up to you to learn. So I went to a place where you can see a lot of patients. Simple. I went to a place where you can see a lot of patients. So I started working as a trainee in a private hospital, polyclinic, not polyclinic, it is multi-specialty hospital. with all specialties. From 98 to 2001, I started working in every department for 3 months with or without salary. 3 months in every department. Starts from emergency medicine, oncology. Oncology, luckily or fortunately or unfortunately, oncology was my first posting. Then radiology. Radiology also worked. Radiology, hematology, gastroenterology, medical and surgical, nephrology and urology. One is medical and surgical. Endocrinology, psychiatry, everywhere I worked. I spent adequate, I invested my time for my personal and professional development for 3 years. I didn't think about what my friends are doing. My friends were doing. Right? When I came out of my college in the year 1998, I finished my BSMS. When I came out of my college, we were around 110 people. We were around 110 people, but government examination was called for 127 seats. So, the probability of getting into government service was very 100% for me. We were around 100 odd people to fight for 127 seats. I had a high possibility to get into government service, which I skipped. I didn't go because I didn't even had the guts to go get into an office where I have to work under somebody, doing things which several times we don't want to do. So I didn't know. It's a conscious decision not to go get into government service just for financial security. But then I started working. For 3 years, I didn't think about any practice. 3 years. I started working in a private hospital. Initially, yes, as expected, initially, they didn't even recognize me. I was thrown out. I was insulted. But I was ready for everything to learn what is what. So the 3 years went down. One fine morning, I thought, your time is enough, we have to start our clinic. Then I started my clinic. So nearly 3 years, I spent my time for learning. This particular confidence, confidence started going up. I assess my competence. So competence is very, very, it's a relative word. If you assess your own competence, always you'll be so biased. You will never underestimate your own skills. We should be between confidence, self-confidence, and assessing of competence. So you should be able to strike a balance between these two. Then only you can go for learning. Unless you know what you know, unless you know what you don't know, unless you empty your teacup, you may not be able to learn certain things. That's why I request everyone to learn what you don't know first. Learn what is not Siddha. Then let us talk about Siddha. Basic physiology, pathology. Before entering into the topic, I request the admin who is handling this session to ask the participants to ask few questions. I need few good questions, maybe penetrating question or stabbing question, whatever it may be. I'm ready. I need 5 questions. So all the slides what I'm going to showcase already I showcased in several places. Or if this particular slide recently I used for some modern doctors also. So it depends upon the questions and your need only when the style of my presentation would be there. So to decide the density of stuff, I request you people to ask some questions. I need at least 4 to 5. One question I received from Dr. Rahul: is it possible to diagnose cardiac cases as well as liver diseases? It's a very good question. So after his question, I included one particular case study here. So he helped me to change my slide. So I request few more questions, please.
Okay, sir പറഞ്ഞ പോലെ ഒന്ന് ക്വസ്റ്റ്യൻസ് ഉണ്ടെങ്കിൽ എല്ലാവരും ഒന്ന് ചോദിച്ചാൽ സാറിന് അതിനെ ബേസ് ചെയ്തിട്ട് സെഷൻ കണ്ടിന്യൂ ചെയ്യായിരുന്നു.
If Rahul is there, Rahul can ask, fine tune his question.
Rahul.
Hello. Good evening, sir.
Open your video. I want to see your face.
Okay, sir. 1 second. Can you see me now, sir? Okay. Hello.
Please spotlight him. Everyone is a presenter here. Please spotlight his video, please.
Hello.
Yes, please go ahead, Rahul.
Yes, sir. Can we diagnose heart disease and liver disease using Nadi?
Yes.
It is,
What's the intention of, what is the intention of question or the history of question? Unless you have some experience or some bad or good experience, you may not ask this question.
No, sometimes it's like what do you say? In heart disease, we cannot easily diagnose.
So it's a very, very random question or with some specific back history.
No, it's a like I can diagnose a few diseases using Nadi, but I don't know how to diagnose heart disease and liver diseases.
Okay, so very, very random question, no? Very simple random question. Okay, your question has been properly answered in the following slides.
Okay, sir.
Thanks for that. Some few more questions. Thank you, Rahul.
Yes.
Sir, good evening.
Please go ahead.
I'm sorry, video is of Dr. Vindhya and myself, I'm Dr. Jitya. I don't know who is audible.
It's audible.
Sir, good evening, sir. Myself, Dr. Jitya. Sir, actually, in Siddha system of medicine, we are being taught that
Now it is not audible.
Jitya, you are not audible now.
Yes.
Okay, Dr. Vindhya, you can ask.
Good
evening, sir. Can we diagnose the missed periods if one patient is coming in our
sir, it's not audible.
Audible. Please go ahead.
Sir?
Yes, it's audible. Please go ahead.
Sir, if one patient is coming in our clinic with missed period, so by Nadi, can we diagnose it? Is it due to pregnancy or any other thyroid issue or any PCOS? How we can differentiate this one without
Fantastic
any
question.
investigation?
Fantastic question. Actually, it's a surprise that you have asked a question for the slides which I prepared.
Thank you,
I
sir.
actually requested you to give a question to change my slide, but actually you instead it's an anticlimax. You asked a question for the slides which I have prepared. The surprise is waiting for you.
Thank you, sir.
Thank you.
Sir, am I audible now?
Yes, sir. Yes, doctor.
Sir, my question was like, in our Siddha system of medicine, we have been taught as many precursors as are there. Like we can understand through Nadi what is upcoming in their body as disease.
Yes.
But unfortunately, we have not been guided in that way. Because many of the patients coming in our clinic will be having an underlying cause for a reason, for a disease. So through Nadi, how can we diagnose at least without, like for confirmation, we are taking a scan report or something like that. Prior to that, how can we identify a disease?
Fantastic. Your question also has been answered in the slide. So I want to check whether this particular stuff what I have prepared is, whether it is so dense for youngsters or just so I want to check. I'm happy that 2 questions asked already in our cards. Thank you very much. Next.
Thank you, sir.
Hello, sir.
Yes, please.
I am Dr. Arun Suresh.
Yes, doctor.
Sir, I would like to know that which science the Nadi Shastrathile Agasthyar எழுதிப்பட்டது 18 சித்தர்கள் நாடி சாஸ்திரம் இந்த மாதிரி நிறைய லிட்ரேச்சர் அவைலபிளா இருக்கு. இதுல ஏதாவது நீங்க ஃபாலோ பண்றீங்களா?
Yes. I'm going to tell about all the text. No, I'm going to tell all the text evidence what I'm using. I'm going to share the original text also through Dr. Pradeep and my student is there. Through him, I will share all the basic text to you. You need not to go anywhere.
Sir, അതുപോലെ இன்னொരു കേள்வி, இந்த வலி ஏற்படும் போது நம்ம நாடி பார்க்கும்போது அது வர்மத்தால வந்ததா இல்ல வாதத்தால வந்ததா, இது அல்ல வாதம் பழகும் போது அது அல்ல வர்மம் பழகும் போது அது வாதமாய் மாறுகிறது, இந்த மாதிரி டிஃபரன்ஷியேட் பண்ண முடியுமா?
What does Varma means? Varma means, according to your understanding, what is Varma?
No, என்ன வர்ம இன்ஜுரி அல்லது காயம் ஏற்பட்டு சில வருடங்கள் பாஸ் பண்ணும்போது அது வாதமா மாறுகிறது என்று சில நூல்களில் சொல்லுகிறது.
Fantastic. I am happy that you understood properly, because a lot of people think that Varma is a treatment. Varma is a disease. For that understanding clarity itself, I want to congratulate you. Your question also will be answered. The Varma is nothing but freaky micro injuries in a specule which can cause a local or systemic disease. That is Varma. Okay. So through that we can diagnose, and I have another slide for you also. I'm very happy to hear such questions. Quality is very high. Thank God.
Thanks to my Ashan, Arjuna sir.
Next. Any other question? Okay. Can we go to the basics? Can I shift?
Okay, sir.
Any other questions? Where it is invited? No. Questions only can fine tune my presentation.
So, sir, another question. I'm Dr. Srikala. So nowadays there are different varying imaging techniques and other blood testers for coming to a diagnosis. So is Envagitarva can help us for the same?
I want to tell you, Envagitar is a I mean, the verticals, I mean, framed several years back, several hundred years back. Now, do you think that it's a different one from scans and all? I will explain you clearly. Scan also is playing a very big role in diagnosis, but nowadays in Chennai, some radiologist when I refer a patient to a radiologist, he used to call me, and what do you think? What is in your mind? There is a picture. I can tell you that there is a granulomatous lesion. There's some perilesional edema is there. But before putting my diagnosis, what is your take? He used to ask me. So through what I assumed, or what I predicted through Nadi has been taken into consideration before writing a diagnosis. Before writing a report in an MR report, nobody's. So don't think that is a separate arena. This is separate. Everything is same. By the end of the session, you will come to know that.
Thank you, sir.
Thank you. All are good questions. Okay. Shall we move?
Okay, sir.
Yes, sir.
The basics is very, very important. Without basics, without anatomy, physiology, if you are in a stone age, you need not to talk about anatomy, physiology, biochemistry and all, but we are in 2022. We should know anatomy. Without physiology, without biochemistry, without pharmacology, without then Noinadal. Noinadal is a very big topic. In those days, these things were not there. These things, these understanding, this micro level somatic understanding. This is called typical main jnana. Main means truth, and main means unmai. Main means body. Jnanam is about is knowledge. Without the term main jnanam itself says that the knowledge about body, the knowledge about truth, the true knowledge about the body. So the microscopic explanation of those tattvas are anatomy, physiology, and pathology. So don't think that we were preached that English medicine is different and we are different. English medicine, whatever they use these sort of technology. For me, anatomy is a technology. It's not a subject. It's a technology. Physiology is a technology. Biochemistry is technology. It is not a separate science. So without these things, we may not be able to understand certain things properly. Instead of assuming certain things, we people love to believe certain things. We are not ready to make it clear or understand. Instead of believing, we should understand certain things. I learned Nadi only through modern medicine, not modern medicine, modern science. I learned everything from in that arena. I cannot lie you that I learned everything from a guru. I didn't learn that. So while explaining, you will come to know that whatever our text has documented, everything is inch by inch true. I will explain you clearly. But before that, three things are there. First one is ethics. Ethics should be given the topmost priority. Why ethics comes to play here? 70% individuals, I don't want to call them as patients, 70% individuals are treated even without any disease. 70% individuals are being treated even without any disease. So when ethics comes first, in my clinic, in my entire life, I have seen a lot of patients, only 30% patients only I treated. 70% I just reassured them, you are normal, you don't have any disease. This scan report is nothing, in no way it is connected to your complaints. You think that you have disease, you don't have. This scan report nothing to do with your health. So I have more than 70% patient, I reassured them, I made them to understand that they are not patients. Through that only I became popular. So ethics, the first thing which gave me everything. Second is accept your limit. You should know what is your boundary. In cricket match, if some acrobatic style catch has been taken in the boundary line, and whatever he does in the atmosphere, in the sky, it won't be taken into consideration. But where he lands, if that fellow lands within the boundary, it has been registered as the best catch. It will be there. It will be in history. If it lands outside the boundary, it won't be even considered or even be remembered. It won't be even recognized. So to do wonders, you should know your limit, your boundary. Unless you know the boundary, you may not be able to extend the boundary. To extend your boundary, first of all, you should know what is your boundary. That's why, first of all, you should accept your limit. Several times in several presentations, I used to put on one poster, Sachin Tendulkar leaving a ball. Sachin Tendulkar is the best batsman the history of cricket ever produced. But he is popular. He achieved everything, not because he knows all the shots available in a textbook of cricket. Not because he knows all the shots, but he survived for more than 25 years just because he knows which ball he can leave. He knows which ball he can leave. He knows which ball he can leave it to a wicketkeeper or anyone else. Which ball he can leave, he knows. That is called limit. Just because he knows his limit, he survived for a lot and he did wonders. That's why when there is an ethics, when you follow an ethics, definitely you will accept your limit. To accept your limit, you should know what is your limit. Unless you know a limit, you cannot refer a patient in time. If you refer a patient in time, they will come back to you because since you are the master. But if the patient think that his doctor is not capable enough, he will himself went to another doctor. That is a totally different story. If you refer a patient, it means that you have referred the patient, he will go to a physician and come back to you only because since you have diagnosed and you guided him. If you refer a patient, it means guidance. If the patient himself went out, it's a totally a failure. Then learn from mistakes. I am a senior person. I am a senior because I have done a lot of mistakes. My mistakes become a lesson to you all. When I warn you, don't do this, don't do that, it means I have done the same mistake and suffered a lot. That's the scenario. So ethics first, accept your limit, refer the patient. I'm not advising to refer all patients. Refer a patient who is in need of reference. Then learn from your own mistake. Wait a minute. Okay. Practice based on evidence. Practice based on evidence. I have never suggested a drug without any book evidence, proper text evidence. Second thing, I have never ever given a drug just because somebody told. Three things. One senior told you, suggested you a drug. You gave to one patient, he became all right. When you give it to a second patient, he also became all right. When you give it to a third person, the patient is not responding, or the disease is not responding. The fourth one, instead of not responding, instead of responding, became worse. For example, psoriasis. There is a medicine A suggested by a senior. You give it to one patient. It's okay, good, well and good, patient became all right. The second one also became all right. The third one didn't respond. First two is okay, third one is also okay. If you didn't respond, patient will come back to you, sir, the medicine you gave, it is not working. He will come back to you and seek your service. But the fourth one is dangerous. A patient, instead of coming to you, go somewhere else and complain that after taking Siddha medicine, the lesions became worse. This shouldn't happen in your life. How to prevent this? There is no harm in that medicine because it cured two things. No, two patients it cured. So what is the take on this particular history? Instead of thinking, when you start thinking why it is not working, the third question you will think why it is not working. Whether we have to increase the dosage or we have to change the drug. The fourth, we think that this is a drug which you shouldn't give to any psoriatic patient. But instead of this approach, when the first patient is responding, you should think why it is responding. This is the way to change everything. When a patient starts responding to a drug, you have to think why it is responding. What is the rationale behind this response? The same way, when somebody advises you, you always ask what is the rationale behind this advice. If somebody advises, Sirbi like Kashayam, Sirbi like Kudnir for a stone, what is the rationale behind Sirbi like Kudnir? Always ask why, how, and what. The three things you should ask. When you are a student, always you should ask these three questions: why, how, what. When you become a doctor, when you become a senior, always you try to answer if somebody asks why, what, and how. So that's why here, practice based on evidence, always ask. Always ask. Second, occur. How to occur certain things? Yes, you have to go out of your comfort zone. Magic is only out of your comfort zone. When you are in a comfort zone, there is no magic. Always your assessment about your competence mostly depends upon your belief, not about evidences. Appraise means cross check, and you have to appraise both the information which comes from patients, information comes from seniors. Everything should be appraised properly, then apply, then assess. Yeah, this is the same thing in a different words: autonomy, beneficence, confidential, do not harm, equity. I don't want to bore you. So one point I have to make it sure: equity. When a patient comes, don't react to patients depends upon his social status. Whether he's an auto driver or an assistant commissioner of police, your approach should be the same. In my clinic, that's the same. Whomever comes, I have never worried about his identity, social identity. Whether he's a politician, he's a police officer, he's a modern doctor or not, he's an auto driver or somebody else. I have never worried about that. So if somebody comes, for example, one person comes from a central government institution, and he came, he sat in a different Salman Khan style, a Salman Khan style of sitting. He told, doctor, actually, I am from secretariat. I am a secretary of, I told, easy to a complaint. Unless it's something to do with the complaint, I don't need it. Tell me what is your problem. Working in a secretariat is a problem, resign your job. So don't allow anyone to influence you. You need only information about their health. So that equity comes. When an auto driver comes, that you should be very, very humble. But when a person who thinks are so powerful also, you have to optimize everything. From this end to that end, you should optimize everyone. When a modern doctor comes to my clinic also, my approach will be the same. I don't bother about what you are or who you are. I want why you came here. If you want any queries, or if you want any treatment, if you want any treatment, be a patient. Don't try to preach me. This would be my attitude. So the equity should be there, where you should be able to balance this end to that end. This is very, very important from Natrinai. It's an old Tamil literature. Arumbini Urnarku bettadu kodadu marandaitu kodatharavon. It means unless a patient needs, unless patient is needed, you shouldn't give any medicine. Don't give anything which the patient doesn't need. If he is not in need of a certain thing, you shouldn't give. Whether it is a Verma treatment or a massage or anything, whatever it may be. Unless the patient really needs it, don't give it. Patients can understand your ethics, your intention, everything they understand. Your successful practice lies purely interpersonal relationship. It depends upon the trust the patient and the faith the patient imposes on you. That's why always, unless the patient needs, don't give any medicine. If you give something, it should be rational. The patient should need it. I will explain to you later how it is going to be the important practice tips. No means no. For example, if a patient comes to you with acute MI, myocardial infarction, they may ask you, for example, I have to clearly explain you about the certain cardiac diseases. Why every Siddha doctor should know acute myocardial infarction. Nearly 30% acute infarct comes to Siddha OP with the gastric symptoms. In patient with the inferior myocardial infarction, they will come with the burping and this typical gastric issues, some burping, repeated water brush and burping, they used to come. When they come to you, if you suspect, or one doctor asked me how to diagnose cardiac emergencies Nadi, because he's having some experience. That's why he asked the question. I'll explain it later. In such patients, immediately go for ECG. Even though your ECG is normal, you go for treadmill or angiogram. They may ask, no, sir, I have several, for the past several days, I have the same thing. When you go to a modern doctor, they're asking me to go for a certain test. So that's why I came to you. Please give some medicine. But you should say no. Go for some tests and come back. Because when somebody, they directly won't jump into Siddha clinic. They will come to a Siddha clinic only after several episodes and repeated medication, repeated advice where the patient is not happy with the doctor because he is asking for it. They are coming to another hospital where they can give some medications. Their understanding will be different. So they will edit symptoms. They won't tell there's a typical chest pain. They will tell only the burping and all. So that's why when you think that no, say no. That's an important practice tip I want to tell you. Treat the patient, not the disease. Treating a patient, treating a disease, treating a attender, treating a symptom, treating a doctor to whom you are going to refer. You have 5 things you to deal with. To explain to you, if a patient comes with the lumbosacral pain, you shouldn't treat the pain because in L4, L5 disc bulge, 3 types of pain will be may come. First one is protective spasm. Protective spasm is a police constable pain. So always it has to be respected. If you ask the patient, what about the pain? When it comes and when it goes, the patient will tell you, sir, the whole day if I work, evening 6 o'clock, I used to get the pain. But when I lie down, it is okay. Early morning, I'm absolutely okay. It means that purely it is due to wear and tear. Here, the pain shouldn't be treated. Here, the pain should be respected. The pain should be respected. Only the patient has to be treated, not the symptom. So in this patient, we should do something to make him lie down in bed. What Siddhas did early days, they diagnosed these things in their own terms and own language, and they put Suttigai in soul. Suttigai in soul. So the modern day pharmacology, they're telling that this is barbaric. Why they are doing these? What is the connection between lumbosacral pain and the Suttigai in the soul? Nothing. If you put a Suttigai, it will take nearly 21 days to heal. Until then, the patient has to lie down. The patient needs only absolute bed rest. It's a compulsory bed rest which was imposed in a different manner by ancient people. We didn't understand that. We used to do this and we used to allow the patient to walk. So we should understand the concept. There is a context, content, concept, and execution. Unless you understand the concept, you may not be able to configure a concept or execute anything. So if you do see only the context, you may not be able to understand why it was told. What is told and why it was told, you should clearly understand. Otherwise, you will do something the opposite of what was asked. That's why treat the patient, not the disease. How to treat a patient without a disease, I will tell you when it comes to case studies. This is very, very important thing I want to tell you. So several people think that modernization or rationalization of Siddha medicine is opposite to the original Siddha medicine. Nothing like that. New concept is not opposite to the old one. It is an updated version. It is an updation, not an opposite of something. The people, those who are not ready to accept science or learn science, they're going to shell. They're going back to shell and hide themselves behind these conservative people. And for Siddha medicine, we don't need this. We don't need that. That is a negative attitude. Where when it comes to integration, modern doctors are, for me in my clinic, I have nearly 70% reference from modern doctors. I receive patients from corporate hospital just for diagnosis. Recently, I received one patient with a diagnostically resistant abdominal pain. Not recently, few years back. Diagnostically resistant abdominal pain, where all scan, everything filed. Then say send the patient, for my opinion, through Nadi. But just to make them understand, I cannot sit somewhere else. I'm a Siddha physician. I know Nadi. No one is respecting me. No one is coming to me. This blabbering over the streets, end of the streets, won't help you at all. Here we should come forward. We should come forward, and we should two things. We should respect our differences and enjoy our similarities. We should respect our differences and enjoy our similarity. We should shake hands with them with the proper mutual admiration. Mutual admiration comes with after mutual understanding. Unless you come forward, it is not easy. Always backwalking won't help you anywhere. This is for the students. Sorry. Now I am coming to the subject. Vadam, Pittam, Kapam. Actually, as Siddha doctors, the original term is Vali, Aral, and Ayyam. We should use only Vali, Aral, Ayyam. That is the only term our original text told. So hereafter, to make Siddha as a single big entity, we should use. That's why I put the wrong one. Vadam, Kapam, and Pittam. Actually speaking, we should use Vali, Aral, Ayyam. Vadamai padithu, Pitta Vannai kathu. What is the meaning of this thing? Unless you understand what is Vali Aral Ayyam, Vadam Pittam Kapam. This slide made because I don't know whether you are comfortable. We are so familiar with the Vali Aral Ayyam, or I don't know whether already you are taught only Vadam Pittam Kapam. I don't know. So that's why I put the word where everyone knows. But I sincerely request everyone to use Vali Aral Ayyam. That is a typical Siddha word. What is Vadam? What is Pittam? What is Kapam? I want 3 questions to students, if some postgraduates or anywhere else. Define Vadam, define Pittam, define Kapam. Come and do mistakes. We are here to do mistakes and correct it. So don't worry about that. Come, confront me and tell me what is Vadam, what is Pittam, what is Kapam. Anyone else? Let it be a wrong one, because here I don't know everything to teach you, and you are not people who knows nothing to come and learn from me. We are equal. I am a BSMS graduate. You are also a BSMS graduate. No. So please come forward. What is Vali? What is Aral? What is Ayyam? Anyone can try. Because I have given my own definition. Need not be the right one. Since no one has given a definition, I have given. Somebody can challenge me with their definition. Rahul, I know few names, so I can ask that names. Rahul, Dr. Arun, few names. Pradeepan, Prakash is there. Prakash, I think he is a Noyada postgraduate. Someone please. Okay. Yes, someone is coming forward, please. Someone has written, Vadam is a dynamism. Please come forward, please. I don't know the name. So what is Valiralayam and what is Panchakudam? What is the difference between which concept is higher, Valiralayam or Panchakudam? Clinically, I'm asking. So let us don't think too much about texts and what has been written. Clinically, how we are going to use it. I'm a clinician, an undergraduate physician who finished BSMS 20 years back and practicing. So for me, how it is going to be useful, this Valiralayam and Panchakudam. So what is your take on Mukutra aspect and Panchakudam aspect? You can tell someone can write.
Kaba is earth plus water, and Pittam is fire, and Vadam is air plus space.
That is a configuration, no? It is about the configuration. I'm asking about definition. It is a configuration, right? It's a configuration. But what about the definition?
Vadam is giving space to occupy something.
Good. Then, but what about Agayam?
Akayam, in Panchabodha term, Akayam is the space. But in human body, Vadam means for flowing one thing, it needs some space.
Then, what about Pittam?
Pitta is the fire, or for circulating something, we need heat energy.
Okay, Kabam?
Kaba for the proper functioning and for nourishment, etc. Kaba is needed.
Thank you. Thanks for coming forward. My sincere advice to all students, don't worry about your answers. Let it be right or wrong. Always come forward, do mistakes, and you can learn it. You say whatever you want, try to justify whatever you said. While justifying, you yourself will learn what is right and what is wrong. So don't worry about the response or the recognition of others for your answer. Don't worry about your others' recognition of your answer. Please come forward. Next, what about Panchabudam? No, I didn't put a Panchabudam. I'm going to explain everything.
It is one among the 96 principles, and it is the basic composition of our body and the entire universe.
So clinically, how will you define? As a philosophy, you can define it like that. Clinically, how will you define? What is the need of Panchabudam when I'm sitting in my clinic?
Okay, if one patient is coming with obesity, for example, Pratyabodha is increased in that particular patient. For another example, water also for dryness, maybe that patient is deficient of water content or the near bodham in the body, maybe. I must then.
You are a student or a doctor?
Yes. Excuse me, sir.
Doctor. You're a student or you're a doctor? Or what's your state now?
I am an Ayush medical officer working in Ayush dispensary and practicing my own clinic.
Yeah, thank you. Any other thing? Thank you for the response. Let it be right or wrong. It doesn't matter here. I want people to talk. That's all. Anyone else? Okay. Why I am asking these questions? I shouldn't. Shouldn't be too I shouldn't give some LKG answers. I want to assess what you know. So let me come to my own definition. Before that, What is the definition of Nadi? Definition of Nadi? Any definition for Nadi? Nadi is the digital recognition of deranged Mukutram in related to his or her age and gender in an uninfluenced condition is Nadi. Digital recognition of deranged Mukutram in an individual in related to his age, gender, his or her age, gender, and uninfluenced condition. Why I added that uninfluenced condition? Certain modern drugs can change the Nadi. For example, the patient, those who are on warfarin like drug. In a patient, those who are receiving warfarin like drug, you may in any vasculitis patients, no, those who already had pulmonary embolism or deep vein thrombosis, those patients used to be on warfarin for a prolonged period, for 3 years, 1 year. They used to check PTI in INR regularly, and they will monitor PTI INR, and they used to put on warfarin, that is acetram in a modern drug. In patients with acetram or warfarin, you can see only Pitta Nadi. Irrespective of his complaint, irrespective of his the disease what he is having, his Nadi will be picked up. Where Nadi will fail, the only thing you can diagnose is the patient is on warfarin. That's why we need everything, not just Nadi is not enough. I'm going to tell you how, what are the area where we cannot use Nadi directly, but we can use it indirectly. For this patient, are you on warfarin? That's all finished. The patient family, entry family will start freezing. How did this fellow knows we are on warfarin? So when there is a steep Pitta Nadi, if I ask whether are you on warfarin, then easily you can tell by seeing the patient, or do you have any DVT? So straight away you can impress the people. But actually speaking, you have failed to predict the original complaint, but you can pick underlying the condition and your drug influence, and you can tell directly. That's why Nadi is a digital recognition of deranged Mukutram in her or his age and gender based in an uninfluenced condition. Then what is Vadam? Programmed physiological generation. Programmed. It means it's already it's well programmed, distinct physiological generation. One doctor almost reached the same thing. The second is Pittam is protection by meaningful destruction. Pittam is protection by meaningful destruction. Kabam is construction and destruction by meaningful aggregation. Construction and destruction both possible. The thing which beautifies us, which gives some physical differences is Kabam. Construction and destruction also when it comes to disease by meaningful aggregation. This is the basic thing we can define give definition for Mukutram. Mukutram is nothing but Vali Adal Ayam. Vali, I mean Vadam, Vadapudiyal. When you put a floor of Vadam, that is Agayam. When there is a floor of Kabam, that is Man. The extended version of Mukutram is Panjabhudam. Mukutram talks about medical disease, where Panjabhudam talks about surgical disease. That's all very simple. You don't confuse this simple thing with a lot of songs and all. When you want to talk about, for example, in modern medicine, there is MD general medicine. Or one more thing is MS general surgery. MD general medicine, Mukutram aspect, MS general surgery is all about Panchabhudam aspect. When you approach a disease 3-dimensionally, you need Panchabhuda aspect. Just 2-dimensional medically, it is Mukutra aspect. Radiology needs Panchabhuda aspect. I told you, one radiologist called me, where we have to think about that. Whether this particular lesion occupies other organs, that is Agayam. Where it is implanted, whether it is in situ or anything, that is Man. Depends upon these two. The roof of Vali is Agayam, where the root of Kabam is Man. That's all very simple. Don't confuse too much. And I will help you to, I will guide you to apply those things in clinical point in coming lecture. I think we are running out of time, so directly I'm going to subject. Noi Nadal in Mukyatum, the importance of Noi Nadal. This is our anthem of Noi Nadal. This talks about Siddha medicine. If wherever you go, you can use this song to explain anyone else, even modern doctor or a pathologist or a neurologist, whomever it may be, just explain this song. This is Siddha medicine. Just cross check yourself, put your hand over your heart and think, and make it sure that whether we are following this. If you are following, yes, you are a superstar. மதித்திடர் கருவி வாய்ந்த மான்பரி காரமெல்லாம் துதித்திர உடந்தானேனும் துகளர பிணியின் தன்மை பதித்திர உணரானாகீர் பயனுறாளாக நானே விதித்திரும் பிதித்திரத்தை விளம்புதல் முதற்கண் மன்னோ. This is a song. What is the meaning? மதித்திடர் கருமை வாய்ந்த மான்பரி காரமெல்லாம். Karumai means blackness. Madithiru karma means it's about divine. You may have a supreme man parikaram. Parikaram is solution. Man pari supreme. You may possess a supreme solution. Madithiru karma vainda man parikaram. You may possess a supreme divine solution. Tudithira odandananum. Tudithira means you are being celebrated by people for having that solution. You may have it A or B or C medicine. You may be celebrated for having that solution medicine. That solution may be supreme, divine, whatsoever. But Madithiran Karame Vainda Man Parikaranam Tudithira Odandananum. You may be celebrated by the society for having that supreme divine solution. But Tuhalara Pirin Tanmai. Tudithira Odandananum Tuhalara Pirin. If unless you know your disease without any element of doubt, those things will become the useless one. That's the song. Madithirar Karame Vainda Man Parikaramlam, Tudithira Udandanenum, Tukalara Pin Tanmai, Padithira Unaranagir, Payanura Lahanani. It won't be used absolutely useless when you don't know your disease without any element of doubt. That big medicine will become absolutely useless. Vidithirum Pinithirate Vilambudam Mudarkono. Pinithiran is a word Siddha, early Siddhas coined to describe the ability of a disease. Today you may have a fever. Tomorrow you may become all right, or you may go worse. So unless you know what will happen on the next day, you may not be able to treat the patient today. That's the basic thing. This is the anthem of Noinadal. I warn you, if you follow this, no one can beat you. You don't need anyone also. Now I'm coming to Nadi. Anyone can tell me the meaning of this song? Kadu Muraikal Tanitabudu Sandodu, Odur Kami Mundi Nadubarbut, Kadu Nadumuk Kandam Karam Purvum, Odur Muchi Pugar Patum Partire. What is the meaning of this song? I'm 100% sure 90% will tell the wrong answer. Please, someone come forward. Someone come forward and be bold to do mistakes. Someone please. What is the meaning of this song? Nadi Park Medangal, Tadu Muraikal, Tanita Budi Sandodu, Odur Kami, Mundi Nadumarbu, Kada Nadumuku, Kandam Karampurvam, Odu, Pugar Patum Partiril. What is the meaning of this song? There is a completely wrong understanding of this song. No. Everyone thinks that there are the 10 places where you can palpate. Have you ever seen anyone palpating these areas? Oh, now Tadu Murikal Tanita Budisura, Odur Kami, Mundi Nadumaru, Kadu, Nadumuk, Kandam, Karam is the only thing, a place where you can see Nadi. Even our text also explains this is the only place. Nette Vangi Pakunus, Urpata, Yengimi Varangi Pakar. How it can be that explanation? This particular song talks about Pattu Nadi. Idakalai, Pinkalai, Sujimunai, that's 10 Pattu Nadi, Pattu subcutaneous place. The 10 outermost and downmost place where you can see of all 10 Tasanadis. Tadu Muraikal, Tanita Kudisandodu, Oduru Kami, Mundi Nadumarbu, Sujumuni for one, Kudisandu is for Kudisandu for Idakalai and Pinkalai. So the entire thing is about Tasanadi, is not about the place where you can palpate. It is completely wrongly misunderstood and taught. certain things, areas where you cannot even palpate. If this in these places, if you can see Nadi, in several places where if you don't see Nadi, it is a pathology. In several places, if you see a Nadi, it's a pathology. For example, Uchile, if you see Nadi, it's a pathology. If you go back to original text, it has talked a lot. It's a very, very, very rational as well as scientific song, which was completely misunderstood. If you try to understand, is it possible to see all Nadi in these 10 places? You might have started suspecting those teachings. This is the first thing I want to tell you. Always, if you go line by line, always try to understand, try to know what is what. Then coming to Karanadi. What is the definition of Nadi? I told it's a digital recognition of these things and all. Few more, definition came. Originally, Nadi means just approach, that's all. Noi Nadi, Noi Mudal Nadi. Nadi, the term Nadi, the definition of Nadi is an approach of your doctor to a patient, that's all. The approach called Nadi. This Nadi is just Karanadi only. Noi Nadi, Noyali Modi Nadi, Bidi Nadi, Undi Nadi, Karam Nadi. The Karam Nadi, just one word only talks about this digital, radial pulse. We generalize that meaning to Nadi as completely only for radial artery. Nadi means just an approach. Yenvage is a part of Nadi. Nadi, Sparisam, Niram, Mudi, Malam Mutram, Ebayam, Maruturaidam. To be precise. Then coming to Karanadi, heart to hand. Now we are going to that another area where when you do an autopsy, we are trying to understand how we are seeing our Nadi, how a vascular bundle, how a pipe, a muscular pipe which carries a blood can inform everything. It's about the overall response of our body, how we are able to diagnose only through a radial artery. We have to make a cutthroat definition for this. If a modern doctor asks you, so see, we are seeing only a pulse. How can you see three different things? What is the rationale behind it? If somebody asks, what is your answer? Several doctors asked me and I answered, but I want you to know, if a modern doctor comes to you, we are seeing pulse. So through the pulse, how you are differentiating three things. So you should be able to tell them what is that's trident pulsation. But when you come to Doppler science, there are three things. Unless there is a triple mural things, that is abnormal. In Doppler science, unless there is a triple variant, it is abnormal. The same thing when it comes to Vali or Vadam. Nadi. Here I am talking about Nadi. Vali or Vadam talks about the resistance, the peripheral resistance we receive. The peripheral resistance out of any systemic inflammation. The distal one. The Vada Nadi is a distal one. The distal one is very close to anatomical snuff box, where we are seeing the resistance, the pressure caused by the resistance. The second one is Pittam, is completely about the content of the blood. Kabam, what is left over from these two. Vali is about the peripheral resistance. Peripheral resistance to the vascular the flow is not our hand. Then the second one is completely about the content of the blood. Third one is what is left over. That's why always, even our three fingers, the preference of the three fingers also plays a very big role. Why not these three? Why not these three? Why these three? Why these three? Why not these three? And why not these three? So we have the thumb also. Why these three? The anatomical differences, the gradient of the length also plays a very big role in this thing. If you when it comes to Nadi, SOP will teach you clearly. The middle finger, the length and the weight will influence you. It will make you to over palpate with the Nadi. The index finger, always you see your finger whether your index finger and ring finger are equal or bit high, the one is bit high. It plays a very big role in proper Nadi, Nadi palpation. If everyone you can see yourself, your ring finger and index finger will be same for 60% people, but your index finger will be taller than your ring finger for nearly 30% people. 10% people, their ring finger will be a bit taller than their index finger. So the length of finger also plays a very big role in palpation. When it comes to Nadi SOP, standard operating procedure, I will teach you all those things, but now directly go to this subject. Radial artery, right and left subclavian artery. The natural difference. The right, it is a brachiocephalic trunk, then followed by subclavian, then it continues as axillary artery. That's a name, axillary. Axillary sheath is playing a very big role in Nadi finding when it comes to Siddha physician. Axillary sheath is a sheath which consists of axillary artery as well as all the brachial plexus. No, all the three structures will be there inside the actual, sheath, axillary sheath. If any axillary hematoma or any axillary aneurysm, naturally patient will have neurological symptoms. They will have unbearable pain. Instead of having ischemic symptoms, they'll have neurological symptoms. When a patient comes with a neurological symptom where you are not able to see Nadi properly itself, telling that there is an axillary sheath injury or axillary sheath hematoma. So a lot of things. One doctor asked me how to diagnose the underlying diseases with Nadi. So anatomy plays a very, if you understand anatomy, your Nadi diagnosis will go to next level. Right and left, right one is brachiocephalic, left one is a direct branch. This also plays a very big role in diagnosis. I will go to next. Let me explain you. I have to explain you properly. While seeing your patient's Nadi, always you have to adjust their shoulder. Why at the level of shoulder? This is the reason. See, at the level of shoulder, if you extend, if you totally flex your arms, there is, you can see this thing. The arrow is there. The arrow is there. When you totally flex your, this is about the elbow. When a patient flexes his elbow, automatically that artery there is a physiological narrowing and it upsets the flow. That's why the position is very important. Shoulder should be slightly extended, elbow should be slightly flexed and extended towards you. Why there is a Nadi? We instead of a lot of things, why we choose Nadi? There's the only place where it can be extended from patient's body. From patient's body, it can be extended to the physician to get palpated. So how to while palpating Nadi, always I'll ask the patient to slightly adjust his shoulder, his elbow, and wrist also. 3 areas where it can influence the flow. That we have to make it sure. The one patient, I couldn't see the Nadi properly. I told the patient, so I couldn't see your Nadi properly. Then immediately we went for the test. There's a Doppler study, right upper limb, male patient. Right, this radial artery is visualized deep into the muscular plan. No appearance of stenosis or occlusion of any artery. There was no occlusion. There was no any stenosis.
Sorry, sir.
No problem. All the arteries are right upper limb from the level of subclavian, very normal, but the right distal artery is visualized deep into the muscular plan. This is the reason I couldn't even palpate the patient's Nadi properly. So for this patient, I have to dig a lot. Now I have to dig a lot, then only we can be able to palpate. We have to adjust things in. So I use this particular Doppler technology to readjust my Nadi palpation technology. This is one more patient. I couldn't see the Nadi properly. When I couldn't see Nadi properly, that also gave some information. In one patient, he came inside. I simply watched him. He didn't open his mouth. He didn't tell anything about his complaint. I saw him completely. He extended his hand. I saw his Nadi. I told hepatitis C. It is not a magic. There is a logic behind it. I couldn't see the Nadi. Patient had a lot of purpura in his hands. Then he had teresni. When you see his hand, I could see the teresni, purpura all over. Patient had pedal edema. So there is a hypopotamic edema. There is a hypopotamic edema. Patient had a Terry Snyder. So there is a liver failure, hypopotanemia because of liver failure. That is okay. How hepatitis C? Because this hepatitis is the only disease where patient can have this cryoglobulinemia. They will have vasculitis. Hepatitis C induced vasculitis. Because of vasculitis, I couldn't see the patient. Just see this is completely, totally disappeared. I couldn't see immediately. I saw a patient's Nadi and told it is hepatitis C, not because of Nadi. They thought I diagnosed everything through Nadi, but I go through my common sense. Common sense is the the most important thing which you have to possess in Nadi diagnosis. You should have a common sense. Here, Nadi didn't tell me anything. Because of absence, I diagnosed hepatitis C. That's why I put you. When I couldn't see Nadi properly, that also gave me some information what sort of disease the patient might have got. Hepatitis C induced cryoglobulinemia, vasculitis. That's why I couldn't see Nadi. Then this purpural patches, Terry Snyder, hypopotamic edema. So collectively, I gave hepatitis C. It was right. So don't think that the Nadi is an isolated, radial pulse diagnostic procedure. It is about the entire approach. You have to extend your vision. Without that, you cannot reach the diagnosis. So one more patient. This particular patient didn't, but this is a different story. The patient had a Hodgkin's lymphoma, not Hodgkin's lymphoma, a follicular lymphoma. But the Nadi didn't tell the real picture. Now, I couldn't see the Nadi properly. Even though I know the diagnosis, I have the biopsy report, this Nadi was not supporting his diagnosis purely because he had an aberrant right subclavian artery. The subclavian artery was so aberrant, so he didn't carry out the proper Nadi to me. So I did everything to make it sure that why I couldn't see the proper Nadi of lymphoma. I know the Pittakavam is a typical Nadi for lymphoma. This patient had other Nadi. So this is the reason. So always we have to make sure. But I have 20 years of clinical experience. Patient knows me very well. They will do whatever I want. Directly you can tell just because I couldn't see Nadi, go for CT angio. But it is another way to make it sure that how dominant the Nadi is. I'm coming to Vada Nadi. How many hours? Because hereafter it is totally about Nadi. Can we stop it?
No.
Nearly 1 hour over. Pradipam told only 1 hour.
Sir, it's up to you, sir. It's
not up to me, but I should, we should worry about your participants also. They cannot sit for more than 1 hour. Now, some questions.
Would like to continue the session.
It's out of curiosity. I asked some questions. Any questions? We can put in 2 sessions. No, next week also we can talk. I'm ready to talk, but it is boring. I may be Arsha Bogle, I may be whomever, but more than 45 minutes, it is not possible for a human brain to listen certain things. So let me explain the only one song, this is the last one. Let me explain Vada Nadi. One Nadi, one particular case study. Let me finish it off. I have another so many pictures. Sorry. This is one you want to see the most beautiful slide, Pradeepa? These are the most beautiful slides everyone wants to see.
yes, sir.
We are eagerly waiting for your class.
Usually, I used to put this slide at the last, but anyhow, now itself I want to show it out. BSMS degree is just like a blank check. It is up to you to fill whatever you want. I filled whatever I wanted, and still I'm filling and getting money. Or somebody else, no, nothing is written. You can throw into dustbin. Sometimes, you can put only 100 rupees. It depends upon your competence, your confidence. For me, BSMS is an empty check. Any questions? Okay, let me explain this particular song and finish it off. Okay, feel okay? This is a song of Vada Nadi, Sadhaka Nadi. one of the best thing, the very first Nadi I learned, the very first Nadi which surprised me a lot. I give a tip. The 8 and 9 Nadi songs are enough for you. You need not to go to any other text. 9 Nadi songs are enough. Our the father of Noinadal, Dr. Shanmugavelar, did a fantastic job. We need not to do much research. After too much of research, he brought out 9 Nadis as a prime 9 Nadis for all, diagnosis. 9 Nadis is enough for you. With 1 Nadi, I can take whole 1 day to explain you. With 1 Nadi, I can take 1 whole day to explain you. But anyhow, let me give some important points. They all, when it comes to Sadhaka Nadi, Sadhaka Nadi is the base for us, is the Bible for us whatsoever. When it comes to Sadhaka Nadi, the main element is the last line. The main element is the last line. Pedamuru Udarapini Mularoham. It means when the patient possesses this Nadi, they have a lot of things to talk. That's the only thing. One more doctor asked me one question. What about pregnancy Nadi and all? So let me finish. Is there or not? Oh God, that is not here. But anyway, let me explain you. Vada Pitta Nadi is the pregnant Vada Pitta Nadi is a Nadi for pregnancy, early pregnancy. According to Agathir Paripurna Nadi, when it's a classical definition. If a female who is married, with unprotected cells develop Vada Pitta Nadi, it's a sign of pregnancy. Explanation of Vada Pittam. Here it talks about a generation, a new generation with a typical hormonal response. How is clinically evident? One particular patient came to me, the same Nadi if an unmarried as well as a male, unmarried girl and a male, it's a pathological Nadi. For a female with a typical Vada Pitta Nadi, suddenly changed Vada Pitta Nadi is a disease, is a Nadi for early pregnancy. Let me share those slides in the next session about pregnancy. The same lady then Kapapittam at the end. The Kapapittam means there is no Vadam. The Kapapittam means it is no Vadam. It doesn't mean it is not Kapapittam, classical Kapapittam. It is an absence of Vadam. Here, the absence of Vadam is absence of Abanan. When Abanan reappears, that's the date of delivery. Okay, you can assess Vada Pitta Nadi, how it is so helpful for me. In one particular patient, I saw the Nadi, it was Vada Pittam. I was damn sure about pregnancy because I did tests also. But after 3 to 4 days, the patient, when she came back, I see only a Vada Nadi, not Vada Pitta Nadi. The day 1, she had a Vada Pitta Nadi. So I was happy, and I even told her to go for beta CG test as well as TRIDAT. So not TRIDAT, a beta CG test. It was confirmed. But after 5 days, once she came back, I see only the Vada Nadi, not the Pitta Nadi. Vada Pitta Nadi is the classical Vada Pitta Nadi was not the only Vada Nadi. Naturally, the patient didn't have any heart pack. It is an empty sac. So here, when there is a Vada Pitta Nadi, it means there is a generation, new generation, with a beta CG response. It should be complemented. When the beta CG doubles every 3 days, it doubles. The Vada Pitta Nadi, typical Vada Pitta Nadi pattern will be there. When there is a recession or total disappearance, Pittam also will go. When it comes to a pregnant lady, Pittam directly talks about beta CG. Directly talks about beta CG. When you see Nadi, only 9 Nadis are possible. No, arithmetically only 9 Nadis. There is nothing called Mukutra Nadi. The isolated Kaba Nadi is the Mukutra Nadi. There is nothing directly called Mukutra Nadi. Only 9 Nadis are arithmetically possible. Our Southern Nadi also will have only 9 Nadi. Only 9 Nadi we have. We have several thousand diseases. How to diagnose, how to pinpoint a particular disease, particular part and all, I will teach you later. Let me take this Vadanadi alone. Kabapitham is a Uttra Karpinikku Kabapitham. Mudal Karpinikku Vadapitham Yaindu Kanam. That's one line. Another Uttra Karpinikku Kabapitham. Both lines will be there. I will explain you in the next session with classical evidence, classical reports on that. Here, let me explain this Vadanadi alone. Vadaman Nadi Tontil see the Mandamoda Wait to Permanent Thirchi Vayu. See the Murum Krani Kunmum, Krani Mahodaram Niramai, Tiral Vayu Suli Valikadapu Tire. It's not wrong, it is somewhere wrong here. Valikadapu Tire. Idupu Urachal Kadayadu, Valikadapu Tire, it is wrong here. Somehow it was wrongly typed. Neither Kiri Krimi Kunmum Mandavadam, Nilayam Mirik Sarangal Tandu Megam, Pedamura Udarapunil Mularohum, Vehu, yes, and Vehu Pilmi Poradami. This particular song talks about one question. If a Vada disease or Vada patient, usually your understanding is all about any neurological disease or arthritis. You know, you think that a patient with a neurological disease, stroke is a you think that stroke is should be a Vada, but it is in. See. Vedabhagam Vedasolai Pakkavadam. Pakkavadam will be in Kabapitta Nadi. Sorry, Kabavada Nadi. But in Vadanadi, contrast your understanding, you cannot see anything about pain, anything about arthritis or any neurological disease. You think that about arthritis as well as neurological disease are Vada patients. Vadaman Madi Tontil see the Mandamoda Wait to Permanent Thirchi Vayu, see the one Krani, Mahodaram Nirami, Thiral Vayu. Suli Valikadapu Tirai, Idamam Kirimi Kunma Mandavadam, Nilim, Neer creature and Tandumegam, Pedamaru, Udarapunikal, Mularohum, Pesa, nothing there. You cannot see a single word about neurological diseases, I mean, stroke like neurological diseases and arthritis. Here, one particular line I want to point out, Nilayum Neer creature and Tandumegam. Usually, here, Nilayum means as constant, Neer creature means burning maturation, Tandumegam. Burning maturation causing urinary infection. Actually, reverse term. Usually, you see urinary infection causing burning maturation. Here, the patient Nilayam Neer creature and Tandumegam. So, a patient 65 years old, or 65 years old male came to me with I'm having burning maturation. The patient ultrasound report shows some prostatic hypertrophy. The prostate was around 35 grams, and there is no residual urine. There is no post-viral residual urine. So considering his post-viral residual urine and the size of the prostate, that cannot be the cause for this repeated infection. He brought out some urinary test, urinary culture report. Several times he underwent the urinary test. Every time the urine report was absolutely normal. Urine protein normal, culture normal. But he was totally confused and he came to me. I saw him, he was completely Vadanadi. It's a typical index finger, it pushed my index finger. The Nadi pushed my index finger up. That much violent Vadanadi it was. It's a direct diagnosis. There is a Nilayam Neer Kricharangal Tandumam. Here, the constant thing, because of Vadam, Neer Kricharam, because of this constant thing, there is a infection. The only one reason is if a patient is a male, a female, it is meatal stenosis. If a patient is a male, it is urethral stricture urethra. So after seeing the Nadi, directly I advise the patient to go for ascending urethrogram. This is ascending urethrogram. You can see, put a dye in the tip of urethra, and we did a scan. It is called ascending urethrogram. It sees the stricture in the two places. The patient was diagnosed to have prostate hypertrophy. No, he was posted for surgery. Luckily, I stopped that. I asked my urologist to just put a dilatation. Simple dilatation was good enough for him. I didn't give any medicine. I simply diagnosed. To be frank, just for this diagnosis, I was paid more than 6,000 as a consulting fee just for picking the right disease. I didn't give any medicine for this. Just Nadi, Vada elevation, just peaked Vadam. It is totally irrelevant to his complaint. His previous diagnosis made by some other doctors on UTI, another one prostate hypertrophy. Nothing was the cause for the particular patient's complaint. That's why here we have to treat patient, not his symptom. here Nadi played. I can show a lot of other reports depends upon this particular Nadi. If you see it, if you go to any disease in Noinadal, where it is Vada Gunmam or Vada Kalliyal Noi, Vada Kamale, whatsoever, everything comes here only. This particular Nadi will be there. So if you go and see a basic textbook about Vada Kamale, you will be totally surprised to see not even one word about jaundice, the yellowishness or interest in the entire song. If you have any doubt, students can go and check your Noinadal book where Vada Kamale. In Vada Kamale, they have put a word about Kamale, but without any Kamale. It is about autoimmune liver disease. That disease comes under this Nadi only. There we can put it how to differentiate this. 10 lines will tell you more than 350 to 400 diseases. I'll explain you later. I think I have better stop this now. Rest we can see in next sessions. Questions? Questions. One doctor asked about when we talk about Nadi SOP, standard operating procedure, we have to talk a lot about a physician's mindset, the preparation what a physician should do before going for any Nadi diagnosis and all. What are the limits? Everything we are going to talk. Every finger anatomy. A patient with a carpal tunnel, a doctor who is having a carpal tunnel syndrome cannot do Nadi diagnosis. So all those things will be taught you later on. How to keep your fingers fit to diagnose. It's about touching a patient. It will give information. It will go to your brain, pick a file which you saw 7 years earlier. And so I will tell you one particular patient. He came to me with oral ulcers and pain in hands, right hand. It's a male patient. He told, I have oral ulcers, several months old ulcer. I'm taking treatment. Nothing is giving any relief. When I saw the Nadi was so turbulent and it was not properly seen. I was forced to prick and it was so collapsible Nadi and all. Simply, I could diagnose it as Behçet's disease, BHCET syndrome, Behçet's syndrome or disease. It's an autoimmune disease where you have to do actually B5 to confirm it. The triad will be there. One is oral ulcer, genital ulcer, as well as hair fall. Some joint pain will be also be there. A patient will have aneurysm. This particular patient developed axillary sheath aneurysm. Because of the aneurysm, patient didn't have the proper Nadi. We have to put all the information, details make bigger picture. Details make bigger picture. So we should read a lot. We should use everything. One thing I totally forgot to tell you. Yes, this we didn't talk much. In the next session, we are going to talk about the clinical points of this particular Udanan, Vyanan, Pranan, Samanan, Abanan. These 5 things, how clinically important these 5 things are. Next class, we can see. One more thing is Vadathin Purakrivigal. You know that. Odal, Nadatal, Nitral, Kedatal, Asaital. So simple 5, very, very simple tattvam. When a patient has adhesive capsulitis, if you diagnose properly, the disease is because of kedatal, completely movementless. The stiffness is because of. The treatment is little bit acetal, nitral, nadatal. That's a light controlled movement is the only treatment. Whereas when it comes to disc bulge, completely because of wear and tear, the treatment is kedatal. Kedatal is a treatment. Absolute bed rest, with little bit acid. Oral, netral, nadatal, these three things are the reason for the disease. These two things are the treatment. When something is not concomitant with this composition, that is not a Vata disease. I'll explain you. One patient come with low back pain. When he stands, he is absolutely okay. When he stands, walks, nothing there. When he sits, slight discomfort. When he lie down abruptly, he had unbearable pain after few hours of sleeping. When patient lies down, he should be all right. That is not the case. Here, the patient is, when he is walking, he is okay. So it is not a Vata disease. It's over. The definition is over. Then we have to apply our abundant concept. When he stands, he is okay. It means the disease is parallel to the spinal cord. When he stands, patient is okay. The patient's disease is parallel to the spinal cord. Okay. When he sits, he is slightly discomfort. So it is very close to spinal cord. When he lie down abruptly in prone position, in supine position, patient had pain after a few hours. He is okay. He is comfortable. So the disease is parallel to spinal cord, very close to spinal cord. It is anterior to spinal cord, because when he lie down in this position, in typical anatomic position, he is having pain. So it is anterior to spinal cord. Should be some retroperitoneal growth. So Nadi is kabapitam. Should be a cancer. That's all. Finish it. Should be a cancer. So a typical paraspinal, a tumor anterior to spinal cord, posterior to, almost in the retroperitoneal mass. When I did a CT abdomen with contrast, I got the diagnosis of a very big lymphoma. Even when for surgery, the patient came with only this symptom. So if something is not fitting into typical Vata category, you can easily diagnose. You don't need any scan. Odal, nadatal, nitral, kidatal, asaital. Something should fit into this. For example, a patient comes with back pain only early in the morning. Rest is not giving any relief. It means it's not classical Vata disease. It's a Vata Pitta disease. Vata Pitta is all autoimmune disease comes under that. Whether it is Kandaka Vadam. Last question. What is Saganavadam? Our text is superior than modern disease classification, but how much we understood that's a curse of our text. What is Saganavadam? We use only the first or second line to describe a disease. Saganavadam, we know, I am damn sure that no one has passed more than three lines. Only first line talks about cervical pain. The 4th or 5th or 6th or 7th line, you can see typical irritable cystitis. It is about fibromyalgia with interstitial cystitis. This is a disease formation came only after 2000, which is in our text more than 500 years. I don't know. We don't know the time. It is up to us. We only did something wrong to define this by wrong understanding or very poor understanding. Hereafter, go to text. One more advice I want to give you: unfollow the majority. I talk about the entire Siddha field. Unfollow the majority. If you want to understand, unlearn and relearn. Now questions.
So someone asked a question, is the Nadi measurable with equipments? Dr. Vetrivendan asked a question in chat.
Vetrivendan I know, or Vetrivendan is someone is different. Please come forward.
The same only, same.
Vetri?
Yes, sir.
Can you find a device to replace the kiss you are going to give to a kid?
No. Today we are living in a science where we can able to create our own.
No. Science is different from technology. You are talking about something technology.
No. Technology is always science.
No. Technology is other wing of science.
No. Here
it is not possible. For me, it is not possible.
No.
I will tell you why. Why? You can ask questions. I will tell you why. I attended a conference. I was invited by CCRS for a conference where it was about the search of a device. My entire speech is about it is not possible because even the latest sensor, the simulations and sensors, even the latest in the 2022, it is only 10% it can reproduce. That's the same thing what your fingers are doing. When it comes to Nadi, even now, it is all about very mild, trivial nuances of differences, not only by the disease, but also by the patient's position as well as the patient's skin, everything. So when you go deep into Nadi, I will explain you layer by layer. So only a human finger, which is attached to your brain, which stored a lot of files about the past experience. So you are talking about the AI, artificial intelligence. It is not possible in Nadi at present. Even after 20 years, it might be possible. When you just like an adventure movie where you can create a lot of simulations with artificial intelligence, that is not possible at present with the evaluated science. Up to now, the latest simulations, touch simulations, not equal to even at 8% of what your finger can do that. One more thing I want to tell you.
You are not audible, sir.
With I will explain to you. In a patient with hypothyroidism, the normal plane of the artery and the skin, the difference between the normal plane of artery and the skin, it won't be the same for all patients. For in hypothyroidism patient, because of the subcutaneous colloidal deposition, you have to dig all the 3 fingers to touch the top of pittam. Where in patients with hyperthyroidism or in the patient with very thin skin and bony type 1 diabetes, we have to pull back your fingers, all the 3 fingers simultaneously. You have to withdraw a little bit. These adjustments can be made only by a mortal human fingers, not by any device. That is not possible. It's very easy to talk about technology because I am also using technology when it comes to scan and all. I am going to scan centers where doctors are asking me to counter check their interpretation. When even ultrasonogram, CT scan, MRI, 3 things have different type of limitation as and accuracies. Even them, that is nothing is equal to the originality. When it comes to abdomen, unless you open and see, you may not be able to know what it is. Even the latest imaging technique cannot tell the same thing. The same thing applied here. It is purely a touch perception. Perception when it comes to a technological explanation. Even several explanations given by our text cannot be explained in English. So for me, it is not possible. At present, in 2022, February 19 or 20, this particular date, it is not possible. In future, we have to wait and see about the development of technology. Science is a different term, technology is a different term, both are not same. So when in a scientific world, understanding Nadi is possible. Explanation of Nadi is possible. We can make all the modern doctors, even hematologists and vascular surgeons to understand Nadi is possible. But making a device up to now, I don't think it is possible. I won't tell it is impossible because what is going to happen after 20 years, I don't know. Up to now, technology has to come, yet to come with the terms of the touch perception, accuracy with the human fingers. Any questions?
Next question, Dr. Sneha asked whether it is possible to recognize ovulation through Nadi.
2 things. What's the question?
Is it possible to find ovulation through Nadi? Ovulation.
Ovulation.
Okay,
Why? Why that question?
Dr. Sneha.
Yeah. Why that question? Because certain things can be asked by history. Why that question? That's my basic thing. Nadi is not astrology. It is a science. It's a diagnostic tool. Here it should be used only when it has to be used. For example, several things. What is the easiest thing to diagnose pregnancy? Anyone?
So just ask to the lady.
That's all. Pradhiman, good. Just ask them. So simple things are always there. So always don't violently, forcibly push Nadi into everything. Several places Nadi won't work at all. For me, after 20 years of clinical experience, what I can do, I can cover up my minus point with the science. One particular patient, I couldn't even see the Nadi properly. I have put that Doppler scan earlier. in that particular patient, I couldn't diagnose anything through Nadi. I was able to see the pulse, but Nadi was not so evident. I couldn't see. I became totally digitally handicapped for that patient. I covered everything through with my other clinical skills, other skills I possess that helped me to bail myself out. Patient I even couldn't understand that I couldn't see Nadi. We have several other methods. So Nadi is not an isolated weapon for a doctor. In one seminar, I was addressed as a Nadi specialist. He will be severely irritated by that terminology, because in modern medicine, no one is calling a particular doctor as a stethoscope specialist. No one is calling a doctor as an abdomen examination specialist. It is part and parcel of your profession. Everyone should know Nadi. A doctor should develop something for Nadi. One more doctor, senior doctor is there. He's too good to diagnose it, but he never used Nadi. But he can diagnose. The thing is, we should diagnose. Nadi is just approach. Luckily, I had a ground to understand this digital, I mean, the radial Nadi, so I could achieve. But it doesn't mean that somebody is not well versed in Nadi is not a person to be portrayed as a best doctor. The same here, Nadi shouldn't be forcibly pushed in any area. Theoretically, I can answer this question, whether you can find out ovulation in Nadi. Yes, we can find out. But my question is, when it comes to clinical medicine, you should always history-taking skillful listening, examination, then comes Nadi. I think my message is properly conveyed or not? Whether ovulation has our question should be whether ovulation has a different Nadi, whether anovulation has a different Nadi, whether menorrhagia has a different Nadi. If that question is kind that way, yes, we can answer. But if you ask me whether you can diagnose ovulation, my question is, do you think that ovulation is a disease? Please come forward.
Good evening, sir. So myself, Rohini. So how can we learn Nadi thoroughly, sir, in our clinical practice? By seeing how many patients. By seeing how many patients we know that we'll be in a good condition to understand Nadi.
Very simple thing is, go to any school camp, try to see patients from, kids from 9th standard to 12th standard, and see Nadi. What is an average? To learn Nadi, you should know what is normal one. What is a normal Nadi? You should learn a normal Nadi to understand the disease first. It's a very big process. If you are very serious into Nadi diagnosis, first of all, you go to schools from 9th standard to 12th standard, see the Nadi, then you will find out this is normal Nadi. Then only you can start differentiating from one to other. This is my advice. I went to school camps, nearly more than 10 to 15 school camps attended before I started talking about Nadi. 2001, I started my clinic. 2012 only, I started my first presentation about Nadi. It took 10 big years to learn, several years to learn what is normal Nadi. Then only slowly, even still I'm learning. Still I'm doing mistakes. A few years back, the mistakes I did, other people could realize. Nowadays, I have become a very, very good criminal to cover up my own mistakes. Even no one can understand that I did a mistake. Still, I'm doing mistakes. I'm trying to correct myself. So you have to go to school camps to understand what is normal Nadi. Then only you can jump from normal Nadi to pathological Nadi.
Thank you. Thanks.
Another question. It's a good question.
This is what I'm trying to explain it. If we have a standard format of like in the simulator, like people go for driving school, they have a simulator kind of a thing. So why don't we have such kind of a thing that can be devised so that will be useful for the people to understand what is the normal first. Then if they go and see the patients, then they can able to see the abnormal things.
Yes, you are talking about rationalization. That is very tough. Even for when it comes to kids also, when you go to school camp only, you will understand what I'm coming to say. A patient's hand circumference, your fingers, a patient's hand circumference, his age, the way he sits and all, we should adjust everything. Even mood also playing a very big role. For example, if somebody is very angry, very upset also, it influences Nadi. I put a word in an uninfluenced condition. Even for a mortal human fingers, the patient shouldn't be in an influenced condition. But when it comes to simulations, I was a fan of technology. You know that by seeing my presentation, you should have understood that I'm a fan of technology. But technology has what you are putting inside, what you are going to put inside, what you are going to feed inside only is going to tell the truth. So when even the intelligence itself not good enough to touch the optimal level, artificial intelligence, how it can be? So it is too early. We yet to develop. Not us. I'm not talking about Siddha people. It's about the Mediterranean people also. They yet to develop that sort of simulas or simulators to recognize this sort of things. Where when you put down, for example, some people, even my students, when I teach you, the middle finger, the length of the middle finger, because of the length and the weight, when you don't know how to put equally, always people tend to palpate Nadi. There is a palpation of Nadi will be there. So the same thing will, if it is a simulator or it's artificial touch sensor, I don't think. No. One more thing is, when it comes to Nadi, only 9 Nadis are there. So you can put Kabavadam, Kabapittam, but here Nadi diagnosis is not about putting Kabapittam or Kabavadam. Kabapittam itself has several other diseases where we have to interpret properly with all the other information. That's why Nadi cannot be isolated separately as a technique, as a technology, and making as a device. It's a technique which has been incorporated with all the details we perceive, we receive, both subjective and objective symptoms. That's why I don't want to separate Nadi from the regular vital 8 diagnostic parameters. Have I explained properly?
Yeah, you have explained it, sir. But my long-term dream is that we have been contributed to the science and we have been contributed to the technology. That's why we couldn't be able to. We are always speaking theoretical thing, but we haven't come out.
No, it is a totally misunderstood word. We need not to contribute anything to science. Science is not a separate entity or commodity where it needs contribution. You can tell we didn't use it. You didn't use it. We can tell like that. One more thing is, certain things are classicals. Certain things are classicals. Where we have to go, we have to take a giant leap to make it practical. To make it practical, our ultimate aim is to come out how it is going to be useful, how it is going to be accurate. Even now, the classical stethoscope has to be replaced. Lot of digital parameters, digital thermometers came. Nothing it could come near this normal spigometer. They developed a spigometer. That's all. Stopped. Rest of the things yet to beat it. The same thing comes to stethoscope. Stethoscope is the only thing. They yet to develop another thing where we can put a heart sound and artificial intelligence shows a diagnosis of this sort of a murmur and all. Have you ever seen a cardiologist using that? They use only the stethoscope. Certain things cannot be replaced. This is not my argument or policy, my experience. So I was the person who thought that we have to make a device in the early stage. But once you learn the nuances, step by step, the Noinadal book, we have the Noinadal book. When I was doing my 4th year, I started laughing at it. When I was about to write my examination, I started crying because of the songs and all. After some time, when I finished, I started I was so curious and started. I was so surprised. At present, I am worshipping that. So it depends upon our growth, our development. That the thing is so same. The book is the same, but depends upon our development, our maturity. It is different. The same thing comes to Nadi and instrumentation. Once I was thought, I also thought like Vetrivendan, it is possible and we ought to do something. But once I started learning everything, then simultaneously I was updating my knowledge about these touch receptors and all, what they are doing in the laboratory, or what sort of how accurate they are at present in the present junction in the 2021, 22. You just go and check. Not even 10% they have reached when it comes to accuracy of a human finger. What the sort of information a human finger can give it to your brain, it is not replaced unless you develop develop something to replace that. It is not possible.
Yeah, it is not going to happen in a single day, but it's a process that we have to be contributing our own.
I'm not too negative about that.
No, I'm not telling that you are negative. I'm not telling that you are negative, but you are just sharing your experience, what you have been having for the past 2 decades. But my wish is still I have joined my Siddha medicine at 94, and it's about 2.5 decades. But still, I'm saying that we can't able to contribute, and we have been started from Siddha n number of years. We have been saying that Siddha is there for 3,000, 4,000 years. We will still we keep on saying that it is it's an ancient science. It cannot be proved in science. But science is one which is to be proved, because the evidence-based medicine is needed today. How to prove that? Because
what is science?
Classical, whatever we say, that
define science.
We have to question that, and that has to
define science. What is science? My question.
Which is can define and be proved.
No.
Then what does it mean?
Let me give you a definition.
Which will Siddha medicine will come under the science, or
it need not to come under science. First of all, let me tell you what is science. Let me tell you.
How can it be?
There is a standard definition of science. There is a standard definition. Even it is a misunderstood word properly. No, science, an organized way of studying things and finding answers to questions.
That's what
science is defined as an organized way of studying things and finding answers to questions. That's all. Simply science means that's all. Science is not technology. Technology is the instrumentation part of science.
Yes,
I tell you, organized way of understanding. What is organized way of understanding? Tirada Vadagunmum Tirum. Tirada Vadagunmatirku Sembu Perpum. Yes, so there is a sentence. This sentence has more than 100 years of history. Why Tirada Gunmum? Tirada Vadagunmum. Why it is Tirada Vadagunmum? So what particular Gunmum is there? There is a diagnosis. When it comes to Vadagunmum, cannot be treated completely. It is completely not treated. Up to several years, it was there as the disease which cannot be treated. Then one person came with repeatedly it was done. One day, one person came with the medicine called Sempu Parpum. He think that with Kayamucharu, if you give, it can cure Vadagunmum, which is said to be a Tiradanu. What is science? If somebody asks what is scientific, you just ask them. You just ask them what is science. What is mean by scientific? What is the meaning? Before telling scientific, what is the meaning of scientific?
I pursue
science. No. Tell me one thing. Recently, I received a message from someone. There is a paper about Lancet. It's published in Lancet. I went through the paper. It does nothing. When it has a template. When something is in a template, it's properly written. If it is published in a peer-reviewed article, it is accepted. But for me, what is the content? Nothing. So here is all, medical system is all about curing a patient. There should be some repeatability, reproducibility, then automatically it will become so reliable. The three things are there. That's all. We don't, science is not a separate body. In Siddha system, if you go to the text, you can see science in that. People think that science is a different thing and Siddha is whether Siddha is scientific. I don't know what it is. What do you think about Tamil or Malayalam and language? When you talk about when Malayalam and Tamil becomes a language, it is good. Actually, it's a language. But everyone thinks that English is the language. The same thing can be applied here. That's the problem. What is meant by science? Ask people to define it. What does mean by technology? Ask people to define it.
No, technology is a tool to define it. But
That's all. Simple. True. It's a device. That's all. It is not science.
A concept. It's not a device. It's a concept to define it.
It is simple thing. So always, whatever people ask, what's the contribution we can? We need not to contribute anything to anyone. Our duty is to save patients, save people. If you are so scientific, if you are so rational, if your question is rationality, that is different. But scientific is not. It's a wrong word. Choose of words. If you can ask me, we should be so rational. What sort of rationality we have? If you ask me, I will answer that question because it is very, very, very needed one. Rational thing need not to be a scientific thing.
Why rationality is always science, sir? Because
no. Rational thing is always rational. Science is when you see something and if you try to understand this in a proper way and keep on changing your understanding, that is science. That is a definition of science. If it is repeatable, if it is reproducible, if something is repeatable, if something can be reproducible, then it becomes reliable. That when something has reliability, that is science.
That's the same. I could add up some more thing that if it is not working, definitely we should take it out. We should not that just because it's a classical thing. We should not repeat it. That's what my.
We need people. We need separate people to tell in their own language because we have several. Basic medical scientists we have. Several people went out to learn certain. Other medical courses. They have to bridge the gap. Here we need the language. Language means not English. We need a separate language to tell certain things. For example, what is Sutikai? How to explain Sutikai? People think that it's Artery. That is not Artery. No. So we need separate people to work in this entomology, epistemology, ontology, and posology, like things. We need people to help us to come out in a way which is believed to be so scientific. I again repeat, which is believed to be so scientific.
No. So for example,
because I have met a lot of modern doctors, super specialists. No one has any doubt about science. What's the meaning of science? They know clearly. The people, those who are talking about science, those who don't know what is the meaning of science. That's my answer.
No. For example, this is the last question. I don't want to make it a long debate.
You can debate. I'm here to talk.
We can debate because you are my senior and I have all right to debate with you. But people,
you can.
53 people are there. We should not waste their time. If, for example, if Sutiki is there, if it is working for a number of patients, definitely people will come to that and definitely what is the science inside it, and definitely people will take it that other way. So once if things are not working, definitely.
No. The problem is when you are capable enough to explain a person, when a first patient comes and asks about the rationality or scientific aspect of one particular thing, when a person comes to you and asks you, when you are capable enough to answer it, no one will ask you. Because I am not in a village. I am in a Chennai city where I am here fighting with all corporate hospitals. Whatever I do, for example, I pulled patients from theater. When I diagnosed a patient with a neuroendocrine tumor, which was misdiagnosed as adenocarcinoma with a biopsy report. When I pulled a patient from theater, the pressure I might have come across from a doctor, the hospital, the corporate setup, the patient attenders. Unless I am scientific, I may not be able to prove my diagnosis and thrive. So it is up to an individual to tell the world that how scientific a Siddha is. It is up to an individual. You have two choices. When you can come forward, stand alone and deliver. Second thing, you can run away. You can run away and accusing others that we are not scientific. You have two things. You should choose the first one. You should listen to people, those who are telling that it is scientific. Why I am so irritated? I have never received this question from modern doctors. I have never ever. I don't know why. I received this question only from people, those who are not doctors or those who are not practicing. That's the problem. When a person who wants to understand what is science, what is Siddha, when they are properly explained, it can be easily done, because there is nothing called this is that word, that this, everything is about individual. Only individuals making decision.
Modern doctors keep questioning us. That's why we are.
I have never received questions.
No, you may
have all the specialties. No one asked me about that.
You may not be coming across, and if Kerala people might be knowing it about the doctor.
No. That's why I want people to understand. I want, first of all, always try to define everything and ask definition. If somebody telling the hepatotoxic, tell me. Even I came across such patients, but I bravely encountered this thing. One of my junior, I want to explain you. One of my junior who sent a patient who treated with one particular metallo mineral preparation, patient developed some acute renal failure. So naturally, the nephrologist told it is because of Siddha drugs. What an youngster can do, simply he called me and referred that patients are there creating problem and all. When they came to me, I received the patient, I examined clearly. When ultimately I came to know that it is SLE, it is systemic lupus erythematosus. Patient developed as lupus nephritis. The problem with the boy, Siddha boy, is he didn't diagnose it as SLE. He thought that it is rheumatoid arthritis. The nephrologist himself, he didn't realize that it is lupus nephritis. He thought that a rheumatoid arthritis patient treated by a Siddha drug caused renal failure. After that, I called the nephrologist. In which institution you passed your DM nephrology? What is the biopsy report? What should be the biopsy report if a patient developed renal failure because of Siddha drug? Tell me. If you are good in histopathology, tell me what should be the biopsy report to accuse a Siddha doctor or Siddha medicine to cause drug-induced nephritis. He didn't have any answer. It is your problem that you think that they know everything. They have very limited knowledge in their own system. So in the name of science, everybody is bullying Siddha system. But if you learn everything, then only the day you will come to realize that everything is scientific, need not explain anyone. If they want to know, first of all, learn Siddha medicine. You can tell that learn our fundamentals, that learn our Gunapadam. Then you won't ask this question. This is my advice.
No. Let me complete with this one few words. And almost everyone is from Kerala, and they may be aware of Dr. Abhay Philip. Is a hepatologist from Kochi. He's the one. Yes, he was the one who keep on accusing our system of medicine.
I'm very eager to meet him. I'm very eager to meet him.
We had a Twitter space with him, and I tried to argue with him, and he clearly mentions that you cannot be able to quantify the things. If you can't be able to quantify the things, then what is the science behind it?
Ask him about the definition of science. At least let me have this thing with him directly.
We can argue, sir, but
one more thing, it is not our duty to explain a single person.
No.
Tell the world.
The thing which
so for example, one more information for you. All the information to justify our science and all, I didn't bring from heaven, everything from their own subject. Okay. One more thing, if somebody's mercury level is very high, it is possible without any medicine. The acute inflammation, if there is a disease activity with higher inflammation, the CRP level is high, the bioavailability of mercury, ppm, will be doubled without any medicine. Even though it is given in a permissible amount, the bioavailability very high. The quantification of mercury at present, the modern laboratory system has a quantification method of mercury that is only about the perchloride, not about the elemental mercury. So we should learn those things. When somebody says, okay, what about your inference? You have to ask. You should know what is histopathology. You should know what is these sort of things. When you learn these things, no one can question us. It is up to us to answer.
Because once we come to the public forum, we should not say that we are not questionable. We are always questionable, sir. When we come to the
no, I am also telling you, I want questions always. You have to answer.
Yes.
You have to answer them. We shouldn't answer our own people. We should answer them. First of all, ask them to fine tune their question. For example, one fellow told me that because of Siddha medicine, I have renal failure in the past. I asked, define Siddha medicine. So my style is to ask definition. Even Bilvam is Siddha medicine, Kaduk is Siddha medicine, rice is Siddha medicine. If somebody is eating rice, do you think that he will die after 5 or 10 years? So
we say everything verbally.
Has to answer the question.
We say everything verbally, but they say everything in the paper. But there is a lack with us.
No. Paper is different from modern medicine. Do you think that modern medicine people are scientists?
No. I'm not telling about modern medicine people, sir. I'm just telling about science.
They are telling everything with the paper. You know the entire, pharmacopolitical aspect of papers.
No. We don't want to get into those things because when
it comes to social media, everything is questionable. When it comes to social media, everything is questionable. Not about Siddha. Everyone is questionable. No.
Of course.
Everyone can be questioned. We have a lot of questions. If you post 4 questions, they will run away, man. If you post 4 questions, they will run away. In open forum, in a modern medicine forum, I was pushed by Dr. Sivaraman to answer certain people. The whole day, 24 hours, I waited with 4 questions. They ran away. More than 2,000 modern doctors were there. They ran away. Ultimately, they removed from this group after 48 hours. They didn't answer. We think that we have to listen and oblige. We have never thought that. We have never came forward to talk. That's the problem.
You have a scientific knowledge. Definitely, people will agree with us because you are being with the modern doctors because you have a scientific knowledge with them, and we can able to cooperate with those people.
That's the point. Everyone should develop this. That's all. That's the point. That's my point. Everyone should be capable of understanding and answering. If you understand, you can answer.
Of course.
Maruvu Salamega Megam Varudi anal or one line is there Maruvu Salamega Varudi. Oh, that's only one line. Maruvu Salamegam. Megam is a cloud. No, why that is a diabetes called Megam? Unless there is a cloud inside, there is no water outside. No, unless there is a cloud inside, there is no water outside. That's the reason for the word called Megam. Maru Salamegam Varudi. What is Varudi? Navacharam. It is ammonia. When the Maru Salamegam, excreted water becomes ammoniacal, it is diabetic ketoacidosis. It's one line word, one line. Unless you learn completely, you may not be able to tell them that what we have. I request everyone to learn everything and answer. That's all simple. We need not to blame ourselves. We have to everything done already. It is our duty to learn everything. That's all. Very simple. If scientific asks the definition of science, I request everyone to learn what is the definition of everything. Science, you have to learn the definition of everything. Okay, that's all. We took.
Thanks to the Kerala people that they have been organizing quite good webinars and today
same sort of session. One day I had with one cardiologist, one rheumatologist, one hematologist, one medical gastroenterologist. I was the only person. All the others started asking questions. End of the day, everything kept mum. Because when you start questions to them, they have no answers. We have to start questions. We have to start questioning. Instead of answering and keeping mum, we should start questioning.
Okay. That question, we should have knowledge.
Yeah, that's the basic point. We should have knowledge. We should learn everything.
Of course. So thank you, Siddha Medical Forum from Kerala, giving me such a good opportunity. Thank you. Thank you all.
Welcome, sir. Welcome, sir. Surya.
Thank you, sir, for the kickstart.
Yeah, we should have such kind of debates because we develop with the debates. Debates only will lead to good answers. Simply just whatever they say, we accept it. That's not a kind of science, we learn it. We ask questions, then we should rationalize ourselves, then automatically we will get a conclusion.
Yes, what the Vegetation told is correct. When people started criticizing me, I started reacting in a positive way. I started reacting, I started answering every single question. To answer such question, we have to go back to text. We should understand. So it makes us. So we shouldn't run from question. We should first of all face it. Vegetation has gone to Bangalore 15 years before to confront a different society and came back. That's why he is asking that question. He received such question. That's why he is asking. He's my junior. I don't think that we are enemies.
Yeah, we are very close friends. He's very senior. I'm just having very good reasons for him. And you might be knowing that Dr. Abhay Phillips is a very good hepatologist. And he has a team of doctors where homeopath, Ayurveda, and yoga people are working with him. And he always that I'm not against your science, but you cannot just to fake claim that this is curing, that is curing, and keep the science, come out to the paper.
The problem is here the problem with us, Siddha medicine never told that there is no side effect. Have you ever seen any single text which tells no side effect?
Is also there.
We have registered side effects. In Boer Karpam, there is a separate song about these two things. One is the Isaac syndrome and Moon syndrome. Everything is registered in our text. So the problem is when people started telling that there is no side effect, problem starts. We should accept that. No text has claimed that there is a cure for everything. No text has told that there is no side effect. No text has told that everything can be cured. This is our mistake. This is not the Siddha system's mistake.
The people will accept you.
System is questioned because of people like us who is so emotional. We should either it should be evidence based or experience based. They are emotional. We believe there are certain things. The belief is the problem, not the science.
So that's ultimately whatever I felt. Cyrus told, belief. Just break the belief. Come to evidence based or experience based. That's it.
That one more problem is when people they think that something is scientific, that's also a belief. It's a belief that is scientific. But here, everyone, if someone asks definition of everything, if someone asks rational, what's the definition? Scientific, what's the definition? Technology, what is the definition? If it is hepatotoxic, what's the definition? How hepatotoxic? What about the biopsy report? You ask every question. No one has answer. No specialist has answer. I mean, knowledge in all the field. A medical gastroenterologist doesn't know what is histopathology. So don't think that they have two horns in their head. If you start chasing, they will run away. That's all.
So hope next time I will definitely I will talk to him, and I will we will host a space in Twitter, and definitely you all can join. Definitely.
Yes. But next time, let me bring, if possible, let me ask my modern medicine counterparts to come and join the debate, join the session.
Definitely, we'll have an interaction because then only we know that where the world is going and where we are in that. So then we can able to know that how we can develop this.
The COVID. No, I have a very huge experience in COVID. When COVID came, it stripped naked the entire modern medicine and their scientific definitions. Completely stripped naked the entire modern medicine. I will tell in the next session how. They have no answer for certain questions, but we had. I will explain you in a proper scientific way.
So we had a spaces in Twitter where I was participating that because since I was handling COVID cases, and he said that we came with HCQ, we kicked out, then azithromycin kicked out, ivermectin kicked out. So you keep on sticking to the capsaicin and with no data, how can we?
No. He's not asking why HCQs came. You have to ask why it came. What's the pharmacopolitical background behind this? There is a politics very
a few studies, because everything is based on studies. Few people were benefited with that CQ, they started giving it, and once they did
not everything based on studies. I have answer for that. If somebody comes, I will tell. You are my people. You are my man, and I need not to answer. Question or answer you. I need those people to come, and then I will blast.
The way he debated and the way he explained it.
My biggest plus point is I know everything about them.
Don't have
biggest plus point is
data. We cannot just go on. We cannot go and stand in front.
No, I will tell you one thing. There is a drug called pioglitazone. There's a drug called pioglitazone. Few years back, it was banned. It was banned, and it can cause bladder cancer.
Liver cancer also, sir. Liver cancer.
Do you know why? Because pioglitazone took care of several things. It is a very good hypoglycemic agent. It took care of diabetic arthropathy. It took care of the emotional aspect of diabetes. Single drug. But in the pipeline, few more drugs were waiting to get marketed. But those drugs were nearly 5 times costly. Then unless you ban this particular drug, you cannot bring those drugs into the market. To ban, that's why the paper which was funded, the paper which talked about the cystotoxicity and hepatotoxicity about this pioglitazone was funded by the same company which the pioglitazone owns. There is a very big political background, so-called scientific political background behind this. When they brought out that medicine inside, that was not properly recognized or promoted by doctors all around the world. Then finally, they brought the same pioglitazone into the market with another paper. Which is true. If you think that a paper in a Lancet is a truth, it's a fact, it's a science. Which one is science? The paper published in 2012 or 18? Updation or science is about updation, not about contradicting each other. These things we got to talk when people ask about papers and all. We should be well aware of these things. What is happening around? We should be well oriented with science. That's the problem. We are not reading all those things. Per day, I am reading nearly more than 150 to 200 papers. If you listen, if you read, you can confront anyone else. Any damn Dick and Harry can come. You can confront them with science.
Of course, because I was ashamed to be there because I don't have data, because we have a just with the simple docking studies, because that is nothing to do with the so-called research. So we need to give you the clinical trials. What is the lethal dose of Kabasarakunir and how it is been? What is the mechanism of action?
One thing, I am not a fan of Kabasarakunir.
No.
Let me explain that also.
Because
but the problem with our people is Nilavambu Kudinir is not Siddha medicine. Kabasarakunir is not Siddha medicine. When you people as a whole promoting one single drug and think that one single drug is the system, then it starts backfiring. That's the problem here.
That's the
problem here. So we cannot blame them. The problem is with us also.
Yeah, that's what our Minister of Ayush guidelines is clearly mentioned. The Kabasarakunir should be taken for prophylaxis. They are tearing into me into the basis.
That is not in text.
No such things.
If people start criticizing texts and the original Siddha medicine, then I will pitch in. But if somebody talks about the present scenario about Kabasarakunir promotion on Nilavambu, I think I will go to the other way. So that's the problem here.
That's the rational thing. We have to take it out, and this should be applied in every other aspects also. Then only we can able to grow, because the growing is just keep bad things away and good things in the high way.
Yeah.
Good, sir. Thank you, sir. Thank you for interacting with you.
With this, we'll be concluding the session for today. I would like to thank Dr. V. Balamurugan, sir, for the wonderful session for today, and to giving a kickstart into the knowledge of Nadi and sharing your clinical experiences, sir. We'll be looking forward for more of your sessions, sir, in further future. Thank you, sir.
Thank you very much. Thanks for the. Thank you very much.
Thank you, sir.